When I found out, I was numb because I knew my life would change.
I was 15 at the time, and so it was back in the summer of 2005. And I didn't necessarily react to being positive. It's the actually reacting to it is something I never dealt with.
Muchas mujeres, sobre todo
Many
latinas,
women
no
do not think they're going to get HIV.
saben que
They do not believe it exists.
VIH.
They do not take care of themselves
Algunas tienen
or use the condoms to take care of their health. And yes, they do need more education.
I didn't have any real issues about what was going to happen to my kids or anything like that. I was just trying to deal with the fact that it happened to me.
This is a public health issue. It's about our communities. It's about giving people opportunities and chances regardless of their socioeconomic background or what physical condition they may have.
This program is specially formulated for people that are HIV. We provide nutrition drinks that helps with their immune system. We try to provide fresh produce and milk. You know, we try to do a healthy, balanced bag that they wouldn't get at a normal food bank that is probably available, but we try to cater to the needs of the HIV positive person. Flowers provided us the continuing funding that we needed when Meta the budget was canceled and cut to the state. The Flowers Foundation is probably unknown to our clients. They probably oblivious to the foundation, but it is keeping our doors open. We are still here every day, and thanks to the Flowers Foundation, we're able to continue our work.
The people that our agency, the Black Coalition, serve are generally members of our community who are marginalized or disadvantaged, mostly African American men, MSM. We define them as men who have sex with men. But then we're also expanding to encompass a more broader portion of our community, those who are clearly disadvantaged and underserved and marginalized and have less access to social services in San Francisco. The two men that you will meet in our house today are two African American men who have been here and very dedicated to their sobriety and also to learning and finding ways that can deal with their illness that they're dealing with, and very committed to helping those newcomers in our facility as well.
I believe everybody needs a big brother. I don't care how old you are, but you need a big brother. And that's what BCA did for me. Because I was always the big brother. I'm the oldest of 10. But I needed somebody over me, because I didn't make proper decisions. It took a long time to get to a big brother, but it happened.
Before coming to BC, I spent a month in the hospital. I was, very sick. I mean, I think members of my family thought I would die, but I didn't. Spent 7 months in hospice, recuperating. After hospice, came to BCA. And I can't, it's hard to explain how much it has helped me redevelop as a person, as a human being, to refine, the love that I want to have for everybody, that I want to have for humanity, that I want to have for my family, and that I want to have for myself.
There's a very strong connection between the Flowers Heritage Foundation and the Black Coalition on AIDS. Most importantly is the ongoing financial support that the foundation provides to the Black Coalition on AIDS. They provide funds to our soiree, our annual summer soiree, that allows us to provide critical and very important services to our community and help us enhance those services to our community that is so desperately in need. So without that, I think that our programs would not be more sustainable, be less likely to be sustainable and less effective and efficient. So I am very grateful for the work and the contributions that the Flowers Heritage Foundation is constantly and on an ongoing basis providing to the Black Coalition on AIDS.
At the Downtown Youth Clinic, which is the organization I work for, we serve HIV-positive youth between the ages of 13 to 24. Most people don't know that this population of youth need to be cared for. They're holding a lot of private and personal information internally, and they're dealing with a lot of adult situations with the world that might be perceiving them as to be youth. For example, some youth have to start taking medications, and if they can't rely on family support, then where do they go to get that type of support?
My family just actually found out that I was positive this year, as last month. So it's very recent to them knowing that I'm positive.
Flowers actually helps him in a direct way because he may not see what happens behind the scenes, but he definitely sees the results of the strategies that come into place, the programs that come into place, and even in addition to that, like just the resource that I have that I'm able to find strength and encouragement and to move forward in, and he's able to see that in me. So in this essence, he's seeing that in Flowers.
Their staff is actually surprisingly a very selected group of people that, care. And it's, in my opinion, it's hard to find something like that. And I will honestly say that if I didn't get the treatment that I received from them, I do not think that I probably would have stayed a member at their clinic. And I also don't think that I would be in such a healthy spot right now as far as dealing with my HIV status. And I think it's because of them that I am where I am today, and that I am strong and I've been doing well and I've been dealing with my diagnosis the way I have been.
It's kind of like one of those situations where people are forced to be introspective and constantly have something that's constantly staring them in the face and saying you have to be on top of certain things that no one else knows about, and I feel it's my job to let that person know that they don't have to deal with these things by themselves, to help bring them back to their fullness of feeling like they're still that individual that they were before they walked in the door.
Both of the programs the foundation offers are knowledge-based, whether it's the think tanks where it stimulates thought amongst the stakeholders in the community, whether they're governmental, community-based, or people living with HIV and AIDS, as well as the Don't Turn Your Back on AIDS program, where we go into the high schools and educate our youth about HIV and AIDS and how to protect themselves, and again, that they're armed with good information.
Grupo Fremont helps people with information, education. We provide a social environment for the clients, plus we do advocacy. We get their calls 7 days a week from the clients. And we help them get information from doctors, psychologists, social workers, treatment advocates, and other people that come to the group to give them the most updated information about HIV and AIDS. Right now, we've been operating out of my home since we began in 2003. It's a small 3-bedroom home here in Fremont. Our office is here in the kitchen area where we do all the work we need to do. So we did not have any other place to go. We did not have funds for an office. We still don't have funds for an office today. But we are grateful for the funds we do get to provide the services we're giving to our clients. Ophelia's story is very unique, but yet similar to other women who get HIV without knowing that their husbands or their partner have HIV. Then they're here in this country and they get tested and find out they also have HIV. And we're getting more women in our group that do have HIV, and they get it from a partner who may not have been tested or may have not disclosed that they have HIV.
El Grupo Fremont, la primera vez que asistí al grupo,
The first time
me gustó mucho.
she attended Grupo Fremont, she
el
felt
trato,
comfortable,
la cordialidad, la
a welcoming
amabilidad
feeling
de todos
that
los
she
compañeros.
felt
Y desde
that
ese momento
she
fue
learned
que
a lot of
me animé
information,
a
and
hablar con
that
ella, porque yo me escondía.
that's why
No
she
quería
started talking
hablar. No quería
and feeling
saber.
comfortable to talk about
Y ellos me
having
han ayudado
HIV
mucho.
and not hiding anymore. Bridging the gap is, in my opinion, is bridging the gap between the people that do not have those services versus those people that do have the services. It's bringing communities together, the underserved people that are not getting those services, and getting those services to the clients and the public that needs those services, the underserved populations.
I've worked on nonprofit boards in the past, and I understand from the business standpoint the operational side. And not-for-profit organizations, they may not pay taxes, but resources are so scarce, particularly the way the economy's been the last several years. So we've made it a point, not just the Flowers family, but from Ramsell Corporation side, we want to make sure that we support the foundation sufficiently so that any outside donation, every cent of every dollar, goes entirely towards the programs that we're offering to the community.
I'm proud of myself. I can look myself in the mirror and smile. Although you work and accomplish things as a man, sometimes you frown at yourself, even when you get it ready to go to work. But now I'm not working, but I can smile at myself. And the strength that was given me through here, my big brothers, I'm proud of now.
Flowers is doing something very important for the community, in that it's time to think larger and it's time to lend a helping hand. And if you're going to do that, Flowers is the organization to do that with, because of how they personally affected my life. And I am proof that they do good.